Gentlemen, let's talk about a topic that many of us, especially after 60, might hesitate to discuss openly, but absolutely need to understand. Masturbation. It's a completely natural, healthy part of human sexuality that continues to be important for both your physical and emotional well-being throughout your entire life. But here's what I've discovered in my 10 years as a urologist and pelvic surgeon. After 60, certain habits and techniques that worked perfectly fine in your younger years can actually lead to discomfort or even potential health complications down the road. Today, I'm Dr. Sarah Mitchell, and I'll share with you exactly how to maintain this aspect of your health safely after 60. And more importantly, we're going to explore 3 critical mistakes I constantly see men make that you absolutely need to avoid. This isn't just about pleasure or maintaining an active sex life. It's genuinely about your prostate comfort, your overall urological health, and ensuring you maintain a fulfilling, comfortable, intimate life for years to come. Before we dive in, I want to remind you that this information is for educational purposes and isn't a substitute for personalized medical advice. Always consult with your doctor about your individual health needs and concerns. In all my years practicing urology, one thing has become abundantly clear to me. Addressing every aspect of men's health, even the most personal and sensitive topics, is absolutely vital for your long-term well-being. For older men, masturbation can be beneficial in various ways. Some studies suggest regular ejaculation may help with pelvic comfort and fluid turnover in the prostate, though the evidence on preventing prostate disease remains mixed. It's also an excellent way to manage stress and maintain that important mind-body connection. But here's the crucial nuance that many men don't realize. Your body changes significantly with age. Tissues become drier, sensation shifts in unexpected ways, and certain habits that once felt perfectly comfortable may now cause irritation or even injury. While the act itself remains beneficial and healthy, how you engage in it becomes incredibly important for your long-term comfort and overall health. That's exactly why we need to address these specific pitfalls directly and honestly. Let me start with what might surprise you as the first critical mistake, and it's one that many men don't even consider a problem until it becomes one. The first major mistake I observe is neglecting proper hygiene immediately after ejaculation. While this might seem like a minor detail or something so obvious it doesn't need mentioning, it's actually crucial for preventing infections, especially for men who might already have underlying conditions like an enlarged prostate or diabetes, which can make you significantly more susceptible to complications. Leaving residual fluids on your skin creates an ideal breeding ground for bacteria, potentially leading to urinary tract infections, persistent skin irritation, or ongoing discomfort that can affect your quality of life. The solution here is both simple and highly effective. Always wash your penis and the surrounding area thoroughly with warm water immediately after ejaculation. If you choose to use a cleanser, select a pH-balanced, fragrance-free option specifically designed for sensitive skin. Avoid harsh soaps that can strip away natural protective oils, and make sure you dry the area completely with a clean towel. This simple routine goes a long way in maintaining healthy skin and significantly reduces your risk of irritation or infection. Think of it as essential self-care that takes just a minute but provides lasting benefits. If you're still following along, I'd love to know where you're watching from today. Comment your city and country below, and I'll give you a personalized greeting in our next video. It really helps me understand our amazing community better and tailor content to your specific needs. Now, let me reveal the second mistake that often goes hand in hand with inadequate self-care. This one involves using excessive force or overly aggressive techniques during masturbation. Many men develop habits from their younger years where applying more pressure seemed to lead to more intense sensation. But after 60, that approach becomes not only counterproductive, but potentially quite harmful to your delicate tissues. Overly vigorous movements, squeezing too hard, or bending at uncomfortable angles puts immense stress on your erectile tissues, the tiny blood vessels that supply them, and the crucial nerves that provide sensation. This isn't just theoretical concern. It can genuinely lead to bruising, lingering numbness, or even long-term damage that affects your sexual function. Ironically, that very aggressive approach you might think enhances pleasure can actually reduce sensation over time. My advice for a safer alternative is to focus on gentle, rhythmic motions that prioritize comfort and sustainable pleasure. Take time to explore different techniques that emphasize sensation and mindfulness over sheer force. Think slow, steady, and deliberate movements. It's about feeling the pleasure unfold naturally, not forcing it through aggressive stimulation. Most importantly, listen to your body's signals. If anything hurts or feels uncomfortable, stop immediately and adjust your approach. Here's a question that helps me create better content for you. When it comes to maintaining sexual health after 60, what concerns you most? Preserving sensation and pleasure, or avoiding potential injuries and complications? Type 1 for sensation and pleasure, or 2 for injury prevention. Your responses help me understand what topics to prioritize in future videos. This brings us to the third and perhaps most impactful mistake I see, which is not using enough or the right kind of lubrication. As we age, our natural lubrication definitely decreases, and this change affects everyone to some degree. When you're creating any kind of friction without adequate glide, you're not just risking immediate discomfort, you're actually increasing the likelihood of microinjuries to sensitive penile tissue. In some cases, repeated tissue injury has been associated with conditions like Peyronie's disease, which can cause painful curvature and significantly impact your sexual function. The safe alternative here is straightforward but absolutely essential. Make it a consistent habit to use a high-quality lubricant every single time. Water-based lubricants are safe, easy to clean, and compatible with all materials. Silicone-based lubricants last longer and work exceptionally well if you have drier skin or prefer longer sessions. Though remember, they aren't compatible with silicone toys. Oil-based lubricants can be comfortable but should never be used with latex condoms, as they degrade the material and compromise protection. Apply lubricant generously at the beginning, and don't hesitate to reapply as often as needed throughout. Think of this as protecting and preserving your most sensitive tissues for long-term health. So why is being incredibly mindful about these practices so vital, especially as we move past 60? It's not just about avoiding immediate discomfort, though that's certainly important. It's truly about preserving your long-term sexual health, maintaining comfortable function, and preventing complications that could affect your quality of life. When you treat your body with the care and respect it deserves, especially those delicate tissues, you actively contribute to better blood flow, healthier nerve function, and a significantly reduced risk of injury or infection. Let me share some key takeaways that I want you to remember. First, always listen to your body's signals. Any pain, discomfort, or unusual sensations are your body's way of communicating that something needs to change. Don't ignore these important messages. Second, be open to exploring new sensations and techniques. As we age, what feels good can definitely shift, so be willing to adapt your approach and try different methods. Third, frequency is entirely personal. There's no right or wrong amount that applies to everyone. Do what feels comfortable, healthy, and fulfilling for your individual situation. And finally, remember that both hygiene and lubrication are absolutely essential, not optional. These simple steps bring significant long-term benefits to your health and comfort. Now, I need to emphasize a critical point. While all these recommendations promote safe practices and can help prevent problems, they are never a substitute for professional medical evaluation. If you ever experience persistent pain, any bleeding, unusual discharge, significant changes in sensation, persistent difficulty achieving or maintaining an erection, or any other symptom that concerns you, you must consult with your doctor or urologist immediately. Early detection and timely treatment are always your best course of action for maintaining optimal health. Remember, gentlemen, masturbation is a perfectly normal and healthy part of life at any age. By understanding these common mistakes and consciously adopting safer, more mindful practices, you're genuinely empowering yourself to maintain a comfortable, fulfilling, and healthy sexual life well into your later years. It's about taking proactive charge of your health through self-awareness and consistent self-care. If you found this information helpful and want to support other men in finding these important health insights, please give this video a like right now to help the algorithm share it with those who need it most. Subscribe to this channel and turn on the notification bell so you never miss our practical, science-based tips for men's health after 60. Drop your questions or thoughts in the comments below. I read every single one and often address your concerns in upcoming videos. Your engagement helps me understand what topics matter most to our community. In my next video, I'll be tackling another sensitive but incredibly vital topic that many of you have asked about. Understanding and addressing low libido after 60, including whether it's normal and what natural strategies can help reignite your spark. You absolutely won't want to miss that important discussion. Stay informed, stay healthy, and keep taking charge of your well-being. Thank you for trusting me with your health education, and I look forward to seeing you in the next video. Ich